Hi, my name is Keri Townsend, and I'm the clinical pharmacist for the lung transplant team. Today, we're going to talk about diabetes after transplant. In this video, we plan to review diabetes, discuss why you may have high blood sugars after transplant when you did not before transplant, review the importance of good glucose control, and discuss what affects your blood sugars as well as how to control it. What is diabetes? Diabetes is a health condition that affects how your body turns food into energy. It's a disease where your body does not make or properly use insulin, making it hard to break down sugar. Sugar is the main fuel for your body. Insulin is needed to move glucose from the bloodstream into muscles, fat, and cells where it can be used for fuel. Even if you did not have diabetes before transplant, you may develop diabetes after lung transplant. This new onset diabetes can happen as a side effect of medication needed after transplant and may or may not be reversible. Both tacrolimus and prednisone can cause elevation in your blood sugars. There are certain things that can increase your risk for diabetes after transplant besides medications. This includes being overweight, lack of exercise, unhealthy eating, age over 45 years, being African American, American Indian, Alaskan Native, Hispanic, Pacific Islander, or Asian American, having a family history of diabetes, having had diabetes during pregnancy, and having high blood pressure or abnormal cholesterol. Glucose control is very important after transplant. In the short term, we need this to help promote appropriate wound healing from your surgery. And in the long run, it's important to keep your blood sugar levels in target range as much as possible to prevent serious health problems, including heart disease, stroke, vision loss, neuropathy, which is nerve damage, and kidney disease. Good blood glucose control can also help improve your energy and mood. So what factors can affect your blood sugar? Too much food, such as a meal or snack with more carbohydrates and sugars than usual, not being active, side effects from medications, including steroid meds such as your prednisone, illness. During illness, your body releases hormones to fight the illness, and those hormones can increase your blood glucose levels. Stress can also produce hormones that raise your blood glucose. And short or long-term pain can also cause these hormones to increase your blood glucose. Dehydration can also affect your blood sugar. There are certain warning signs to watch out for diabetes, although not everyone will have these warning signs. The best way to detect your high blood sugars is to test them regularly and follow your blood sugars. Warning signs may be being very thirsty, urinating often, especially at night, feeling very hungry or tired, losing weight without trying, having sores that heal very slowly, having dry, itchy skin, losing feeling in your feet, or having tingling, such as also called neuropathy, and having blurry eyesight or vision. While you're here in the hospital, you'll be taught how to monitor your blood sugars. There are multiple devices that you'll have to help do this. The first is a glucometer. This is the device that will give you the reading for what your blood sugar is. Next, you have a lancing device, as well as lancets, which are the tiny needles that will prick your finger to give you the drop of blood to put in the test strip that you'll place in your glucometer. At home, we will have you test your blood glucose typically 4 times a day, before meals and at bedtime. It's important to document your blood sugars in your post-transplant diary and bring that log to clinic. Using this log, we'll be able to see what your average blood sugars are over time, and we'll be able to know how to adjust your insulin and when we can stop checking. Another test for your blood sugar is the A1C test. This is a blood test done in the lab, which will give us an idea what your average blood sugar level has been over the past 2 or 3 months. This will be checked periodically after transplant. In terms of managing your blood glucose, healthy eating is very important. It's important to pay attention to portion sizes, eat more fiber, and choose whole grains and whole grain products. Avoid sugary drinks, reduce your salt intake, and choose healthy fats such as tofu, walnut or flaxseed oil, canola oil, eggs, and peanut butter. Limiting red meat and processed meats will also be helpful. Choosing nuts, beans, whole grains, and poultry or fish instead is preferred. Exercising 30 to 60 minutes a day by walking, swimming, hiking can also help control your blood sugars. Monitoring your blood sugars as prescribed, again, typically 4 times a day, before meals and after at bedtime. Maintaining healthy weight, reducing stress, and adapting coping mechanisms to manage your stress, such as yoga, walking, or meditation, can also help manage your glucose. And taking your medications, even when you're feeling good. Diabetes medications come in multiple forms. There are oral forms and injectable forms. Multiple oral medications can lower your blood sugars. However, these medications have long effects and are difficult to use early after transplant, as your steroid doses are frequently changing, resulting in fluctuating blood sugars. Because of this, we rarely use oral medications early after transplant while your steroid doses are tapering. Injectable medications are typically what you would go home with after transplant. It's easy to adjust as your blood sugars fluctuate after surgery. Please work with your nurse to learn safe injection techniques for insulin pens, and we will try to send you home with the insulin pen instead of the vials and syringes. There are multiple types of insulins. There are rapid-acting insulins, which will act in 15 minutes and last only a few hours. Short-acting insulin, which takes a little bit longer to start acting, about 30 to 60 minutes, and last longer, 6 to 8 hours. Intermediate acting insulins, which take 1 to 2 hours to start and last up to 24 hours. And long-acting insulins, which start working in 1 to 2 hours and last up to 24 hours. You can take these medications in different ways depending on which type of insulin you're on. Short-acting insulin can be done as a sliding scale. With a sliding scale, we will test your blood sugar, and based on the result, you will take a corresponding amount of insulin. The higher the blood sugar, the higher the insulin dose. Insulin can also be given as a standing dose. This will be a preset amount of insulin that you will take either before each meal, or if it's a long-acting insulin, once or twice daily. And again, the frequency will depend upon the type of insulin you are using. Here we have an example of what an insulin regimen may look like that you could be sent home on. In this example, this patient is on 2 different types of insulin. They're on the longer-acting insulin called NPH, and they take a standing dose, 14 units every morning. This is irregardless of what the morning blood sugar is. This patient is also on a short-acting insulin sliding scale. And here on the right, you see the sliding scale. If the patient's blood sugar is less than 150, then no insulin is needed. Between 151 and 200, patient takes 1 unit, 201 to 250, 2 units, and so on up the scale. Again, a higher blood sugar, a higher amount of insulin. So in this case, at breakfast, let's pretend this patient's sugar is 174. This patient will need to take the 14 units of NPH in the morning, plus follow the scale, and at 174, you'll read across and take 1 unit of insulin. If at lunch the sugar is 266, no NPH is needed, as again, this will still be working from the dose you took in the morning. You will only use the sliding scale, but according to the sliding scale, you will use 3 units of insulin. It's very important to know the causes of hypoglycemia and what these symptoms are. Common causes of low blood sugars are taking too much insulin, not eating enough carbs for the amount of insulin you take, timing of when you take your insulin, the amount of physical activity you have, drinking alcohol, your diet, so how much fat, protein, or fiber are in the meal you're eating, hot and humid weather, unexpected changes in your schedule, as well as altitude and menstruation. So what is low blood sugar and what are the signs to watch out for? Typically, patients with low blood sugar can feel sweaty, chilly, clammy, shaky, dizzy, lightheaded. They may look pale, feel hungry, or feel weak. If any of these symptoms happen, it's important to check your sugar right away and follow the 15-15 rule. The rule of 15-15 is to give 15 grams of carbohydrates to raise your blood sugar and then to repeat the test in 15 minutes and continue repeating these 2 steps until your blood sugar is over 70. These symptoms typically are most apparent when your blood sugar is less than 70. In terms of 15 grams of carbohydrates, this could be 4 ounces of juice or regular soda, not diet, 1 tablespoon of honey or sugar, 5 to 6 hard candies such as Lifesavers, or 3 to 4 over-the-counter glucose tablets. Be prepared and always have these snacks available in case you become hypoglycemic. And if there is a loss of consciousness, it's very important to call 911 right away. If your blood glucose level drops too low, you could pass out or have a seizure. Make sure that your support team knows what the symptoms are to monitor for so they can help you if your sugar drops too low. And again, call 911 immediately. Causes of high blood sugars include stress, illness, eating too much or snacking between a meal, lack of exercise, dehydration, missing a dose of your diabetes drug or taking an incorrect dose of insulin, over-treating an episode for low blood sugar, or taking certain medications like steroids. High blood sugars, you may have symptoms of dry mouth, increased thirst, excess hunger, weakness, headache, dry skin. If these occur, please check your blood sugar. If your blood sugar is high, the quickest way to reduce it is by taking fast-acting insulin, such as Novolog or regular insulin. Exercising can also help lower your blood sugar. If your sugars are consistently high, please call your transplant coordinator so that we can adjust your insulin regimen. When you call, please have your log of blood sugars available to report to your coordinator. Key points about diabetes. This is very common after transplant, and it's very important that we manage this to help prevent long-term complications from diabetes. Starting now, work with your nurse to learn the blood sugar, documenting your blood sugars, how to use insulin pens, and how to do injections while you're here in the hospital. Also learn signs of hypoglycemia and how to treat it. Consider keeping juice boxes, glucose tablets handy in case you need them. If you have any questions about managing diabetes, please ask us.